Jacksonville East is proud to support the J.T. Townsend Foundation, helping children and adults living with disabilities right here on the First Coast. To support or learn more, jtgivesback.org.
Wayne Hogan of the Terrell Hogan Law Firm.
I'm Wayne Hogan. It's the #1 killer of teens. One text or call can wreck it all. Let's put an end to distracted driving.
Learn more at waynehogan.law.
Baptist Health is a proud sponsor of First Coast Connect with Melissa Ross.
This is WJCT News 89.9 Jacksonville. Ahead in the next 5 minutes, live local news for the First Coast from the WJCT News team.
Getting a COVID test is getting harder to find. I'm Melissa Ross, and just ahead this hour on First Coast Connect, the Delta variant of coronavirus is rampaging through Florida. Hospitals are filling up with sick and mostly unvaccinated patients. Long lines around town for those seeking a rapid COVID test. Where can you get one? We'll take a closer look with Mia Jones, CEO of Agape Family Health. The latest on the virus, the public health crisis, and what you need to know. It's all ahead. After the day's news.
Live from NPR News, I'm Nora Rahm. Within the hour, a hearing is to get underway on Capitol Hill on the January 6th attack on the Capitol. The first witnesses are 4 police officers who worked to defend lawmakers from a mob of supporters of then-President Trump, trying to disrupt the certification of Joe Biden as president. NPR's Claudia Grisales says the Special House Committee is working on obtaining other evidence.
This panel has subpoena power, and they're outlining the scope of this probe with a focus on getting documents from relevant agencies and parties linked to the attack. And also, they'll identify which witnesses they need to hear from. This could very well include former Trump administration officials and in what order they want to hear them in.
NPR's Claudia Grisales. In a shocking turn at the women's gymnastics team final at the Tokyo Olympics, star American gymnast Simone Biles pulled out of the competition. NPR's Layla Fadel reports USA Gymnastics officials say it was a medical issue.
Biles, a gymnast so celebrated many thought she would only be competing against herself at these games, is out of the team final. She walked off the floor after the first event, the vault, after she faltered on the landing. Stone-faced, she spoke to her trainers. Later, she put on a white tracksuit and she's cheering from the sidelines. It's unknown whether she will compete later on in the competition in the individual events or the all-around individual final, which she won at the 2016 Olympics. USA Gymnastics said in a statement that she will be assessed daily to determine whether she is well enough for future competitions. Layla Fadel, NPR News, Tokyo.
Russia went on to win the gymnastics women's team event. Tokyo today reported its highest number of new COVID-19 infections since the pandemic began, as the Delta variant drives a surge in cases. Prime Minister Yoshihito Suga is urging people to avoid non-essential outings, but he said that there's no need to consider a suspension of the Olympic Games. Instagram is introducing new safety settings for teenagers, including making new accounts private by default. NPR's Shannon Bond reports.
Kids have to be 13 to sign up for Instagram because of federal privacy law. But some critics say that cutoff leaves teenagers at risk. Now, Instagram says it's making changes to create more age-appropriate experiences for teens. When kids under 16 set up accounts, they will automatically be set to private. Instagram is also taking steps to prevent, quote, unwanted contact from adults by limiting how some adults can interact with teens. And it's restricting how advertisers can target people under 18. They'll still be able to use age, gender, and location, but not other information Instagram tracks, such as users' interests. Instagram is owned by Facebook, which is among NPR's financial supporters. Shannon Bond, NPR News.
This is in.
You're listening to WJCT News 89.9 in Jacksonville. I'm Raymond Troncoso. The Florida Department of Corrections is facing allegations that it breached a legal settlement requiring it to meet the needs of inmates with disabilities. Gina Jordan reports.
The advocacy group Disability Rights Florida has filed a lawsuit. The group has a list of demands for the department to be in compliance with the federal settlement, which was modified in 2018. The lawsuit says the DOC has not properly provided wheelchairs to inmates who need them. It says light boards are still needed to help alert prisoners who are deaf or hard of hearing. And the suit contends the DOC has not provided access to audiobooks for inmates who are blind or have limited vision. I'm Gina Jordan in Tallahassee.
Coming up at 9:30, we have live coverage of a House committee investigating the January 6th insurrection at the Capitol. Tune in on WJCT News 89.9 in Jacksonville. It's currently partly sunny right now, high 70s, low 80s in Jacksonville. Heat index might rise as high as 106. We have a high near 92, and later today there's going to be a chance of showers before 1 p.m., and showers are likely after 4 with a chance of thunderstorms. New rainfall amounts between a quarter and half an inch are possible. Tonight, expected to be mostly cloudy with a low around 77. Make sure you tune in to us with Melissa Ross in about 1 minute on First Coast Connect.
In the U.S.,
Support for NPR comes from NPR stations. Other contributors include Progressive Insurance, where drivers can compare direct rates using Progressive's rate comparison tool at progressive.com or 1-800-PROGRESSIVE. Comparison rates not available in all states or situations.
As COVID cases surge in our area, many are finding it tough to get tested in a timely fashion or even find those at-home COVID test kits on store shelves. Good morning. We're live from Studio 5. I'm Melissa Ross, and this is First Coast Connect. Thanks for listening. Just ahead, the scramble for COVID tests here on the First Coast. Give us a call. It's 549-2937. Then later, special live coverage from NPR News in Washington as hearings begin into the January 6th insurrection at the U.S. Capitol. But first this hour, spiking demand for COVID tests all over town is causing long lines for people trying to find out if they're positive. This scramble for tests comes as the Delta variant of the virus runs rampant through the state. Hospitals are incredibly overburdened right now. They are filling up with patients, and it's almost always the unvaccinated who are coming into ICUs needing to be treated and who are getting seriously ill. Mia Jones is CEO at Agape Family Health in Jacksonville and has some information for all of us that we need right now. Mia, it's so good to have you on. Thanks for joining us.
Thanks so much for having me, Melissa.
And as we talk about the shortage of test kits and the spiking case count around town, give us a call, 549-2937. Emails to firstcoastconnect@wjct.org. Tweets to @MelissaInJax. Mia, we're hearing everywhere that there are long lines for tests. The Department of Health, people are tweeting right now in Springfield, has a line out the door of dozens of people. People are desperate to get their hands on a COVID test. What are you seeing at Agape Family Health?
We're seeing the same thing. I think all of us had reduced staffing, and as a result, because nobody was coming and getting tested, and as a result of that, you have the longer lines because you have fewer staff. We are in the process of working on increasing staff so that those wait times can be lessened. and we are also in the process of identifying other tools that would help us to be able to test faster and additional labs as well. So what you're seeing is just a result of the entire process having to be ramped back up and making sure that we have everything that we need.
Are you seeing a shortage of kits where you are? Does Agape have enough test kits for people to come and get what they need? Because what we're hearing is that there are shortages.
We have not had a shortage of test kits from our labs that we're working with. They have been able to provide us the kits that we need. Our issue has really been just changing in technologies. We were previously using a system that was being paid for by the state. The state stopped paying for that system, so that slows things down. So you're at a manual pace. And so we're working on trying to get that back. That will help us to speed things up. And I think we will be able to do that. But people just have to be patient and understand that, we're doing the best that we can as we, work through this.
You have locations across town for people that might want to stop by Agape Health and get a test, correct?
Yes. We have a location Monday, Tuesday, and Wednesday. Monday, Tuesday, Wednesday, we're at Blanding Boulevard from 11 until 6. Those hours may change. We're trying to be able to increase the hours. And then on Thursday and Fridays, we are testing at our Dunn Avenue location from 11 to 6.
Blanding and Dunn Avenues, 5492937. People are tweeting us that they are having to wait a week to get an appointment at a pharmacy to be tested. So folks are having to turn to the health department, the Duval County Health Department, other health departments, and places like Agape Health. What's your answer to those who think, well, what's the point of getting a COVID test? You might be negative today, positive tomorrow.
It's one of those things that it's just a part of life. We have to work with what we know today, and we deal with tomorrow. But we try to make sure we have in place what we need to have in place. What I have been doing is simply encouraging those in the community who have not been tested to be very conscious of who you're around, making sure you know if anybody with them or if they have contracted COVID, and making sure you're being tested. For those who are out there who have not gotten the vaccine, I encourage you to get it. And so we know that it does not prohibit you from getting COVID, but what it does is it makes your ordeal with COVID a little easier.
Right. Let's talk about that for a moment. You've been providing vaccines ever since they became available. It's primarily unvaccinated people now who are filling up hospitals and getting sick. People in the ICUs at Baptist Health, UF Health, other places say that these patients are full of remorse. They're afraid. They wish they had gotten the vaccine, but it's too late for them to get it once they get seriously ill and have to be intubated, Mia. So what's your message to those out there who are more afraid of the vaccine than they are of the virus?
I think it's really important for them to recognize that that's why we're saying now, get vaccinated. We're seeing the same thing. We give somebody a positive result, and then they say, well, can I get the vaccine today? No, we're going to need you to wait 14 days and make sure your symptoms are gone, and then we can give you the vaccine. It's a wait and see almost. We really, the only way we're going to get our hands around this is to be conscious of what we're doing and what we're not doing. So if you are refusing to get vaccinated, we need you to stay home. if you're not going to stay home and you're going to work or you're out in the community, we need you wearing masks and being very conscious of making sure that you're washing your hands and all of those things, social distancing, that we have said were important.
Right. We've got to do all of the above. One thing that has come to our attention in recent days is concern among some that the vaccines, while such an important tool, could actually lose effectiveness over time, which brings back the importance of staying home, social distancing, hand washing, and mask wearing. Here is a tweet from a listener. This virus is no joke. I did all of the right things for 15 months. Then I spent one weekend in Nashville and I have COVID. I got my Moderna shots back in March and April. And right now I am currently rocking the sweats and a 101-degree fever. Mia Jones, what about this? When might booster shots be available for people who did do the right thing and did get vaccinated, but they might still be at risk of COVID-19, even though they are trying to do all the things health professionals like you say we need to do?
Yes, we have heard that. I've got personal friends that are saying the same thing. But what I had one to say, I got vaccinated, but I got COVID anyway. And she said, but I see the difference because my husband didn't get vaccinated and he is really going through. What we have to do is we're weathering a storm that we're not familiar with. And I think that's the first thing that we need to accept, is that this is something that we have not had to deal with. And so every single day, the researchers, the doctors are learning more and more about this virus and how it acts and how it responds. And we know we're all different. And so just like any other disease that you might get, everybody's body handles it differently. And so I think it's really important for us to keep those researchers and providers encouraged, to keep their heads down and keep their minds open to what's going on and being able to get us a long-term solution. I would anticipate that at some point, if we're not doing a booster, I really thought it would end up being similar to the flu shot. They tell us every year we need to get our flu shot, that we would end up in that type of situation. I didn't get that from any research anybody has shared with me. That is just my feeling, being in the medical profession and watching things as they are unfolding.
Calls now for Mia Jones, CEO at Agape Family Health. We're speaking to her about the testing kits they are providing to folks around town because it's been tough to get a COVID test at local pharmacies. There's a week-long wait. 549-2937. Eric in Arlington. Hi, Eric. Good morning.
Hi, Melissa. Just a couple of quick questions. I promise to stay on topic and be brief. First of all, for
Bless
folks
you.
that are,
Go ahead.
I know you get frustrated with me. I'm sorry.
Not at all.
Okay, so for people that are qualified and not working right now, I heard you say that you're looking for that you might be short-staffed. Where do people go, Ms. Jones, in order to, if that might be looking for work to help you out there? Second question is, what do we know about the people that are getting vaccinated? Are they or are getting tested? Are they already vaccinated or not vaccinated? I agree with what Melissa said a few minutes ago. I don't know what the point is to getting vaccinated. This thing is moving around like wildfire. It takes, 3 days to get the results back? I can't figure out why people are even doing that. And then lastly, if we're not doing reach-out efforts to people while they're in line to get tested, to get vaccinated, I think we're missing a terrible, terrible opportunity because these people are obviously scared. They're in line there. They're handy. I mean, is there anybody there going, hey, you know what? You can get out of line right now and we'll give you a shot and you can go home and you don't have to worry about this anymore. Is that part of what's going on? And if not, why not?
Thank you all for all of those questions, Eric. Mia Jones.
Thank you, Eric. We do advise those that are coming and getting tested of the additional services that we're providing in terms of the vaccine, and we encourage them to get vaccinated. But what I will tell you is if they have not decided that, okay, yes, I'm going to get the vaccine, we can say it 100 times. They've got to get to that point within themselves that they are ready to do it. Unfortunately, we get more people coming and getting vaccinated after they have gotten COVID and have had to endure all that goes along with that. And it's unfortunate. We have had family members who are not positive, and they identify or find out that their family member is positive, and then they're like, hold on, I'm going to get vaccinated now. But, it really shouldn't take that. We watched over a year of families and people suffering and dying. And knowing that, I would hope that people would just go ahead and get vaccinated. The more that we protect ourselves with the vaccine, the better off we're going to be as a community. And it's up to us.
At Agape, do you offer that outreach to people who come in for the test? Do you encourage them to also?
Do.
You do, yeah. And
we have cards that we share with them, and that if they're not ready that day, take this with you and know that we're here, and this is where you can get vaccinated. We're in the process of trying to gear up so that at every location that we have testing, that we will also be able to do the vaccine at that location. Right now, we're not able to do that because of the limited staffing, but we are in Gateway every single day, 9 until 6, providing vaccines. We are going to be tomorrow at having a vaccine event at the Chamber downtown, 2011 Independence Drive from 10 until 5. We're here. We can't be the only answer. And what I tell people in line that may get frustrated because they're having to wait in line is just what you said a few minutes ago. The other game in town is to go to a CVS or a Walmart or a Walgreens and wait the 2 weeks or however long their wait is for you to get in to get it.
Yeah.
At that point, it may be too late.
Maybe too late.
But being able to come out, we're trying out one system that has some kinks, where you come out, you give us your name and information, and then we put you on the list to text you as soon as your name comes up, allowing you to, sit in your car in the air condition as opposed to standing out in the heat, or go and run errands or do things that you might need to do while you're waiting to be texted. And so it's not perfect, but again, we're trying everything we can to improve the processes and to make this situation that we find ourselves in one that is palatable for those who are having to deal with it.
Catherine emails the show. I went to a testing site at Havana Jacks yesterday. That's in St. Nicholas. I know what you're talking about, Catherine. Great staff, very helpful in making an appointment on your phone, so I was seen right away. I'd been traveling, so I felt I needed a test. It was a 2-day turnaround time. Thanks for that, Catherine. Fabrizio emails the show. For those who have already had the virus, what evidence is there that the mRNA vaccine is more effective than natural immunity? Mia Jones, convincing people who've had the virus that they still need the vaccine.
I don't think there has been enough research to say for sure how long those antibodies stay in your system. So I believe that is the main reason why you're being encouraged that although you might have had COVID, that you go ahead and get vaccinated. But I know that those antibodies don't last forever.
Yeah.
And that being the case, we need to still protect you for the future.
The CDC, Fabrizio, and I'm looking at cdc.gov, says you should be vaccinated regardless of whether you've had COVID, because they don't know how long you are protected from getting sick again after recovering. Studies have shown that vaccination provides a stronger boost in protection in people who have recovered from COVID-19. If you were treated for COVID-19 with monoclonal antibodies or convalescent plasma, you should wait 90 days before getting vaccinated. And, we will continue to put this information out as it is being given to us by the public health agencies and authorities. One thing we've seen, Mia Jones, is, as you pointed out, is that we're learning new things all the time about this virus and how it affects us all. Lots of tweets coming into the show. Let's talk about...
I got a quick question for you.
Sure, go ahead.
Have you heard very much about the monoclonal
antibodies?
Antibodies in the program?
I don't think
that are here in Jacksonville.
I haven't, although it's certainly worth follow-up. I know the former President Trump, I believe, was treated that way, and it was a very experimental treatment when he got sick with COVID. Now, whether it's being more widely used, I don't know. The last time I interviewed a doctor at Baptist Health, she told us they were mainly just doing steroid-type medication for most patients, that they are no longer using controversial treatments like hydroxychloroquine and other things like that. Now, that said, that is certainly worthy of a follow-up on our part, which we will follow up on with the hospitals. We're speaking with Mia Jones, CEO of Agape Family Health. If you're just tuning in, we're talking about the shortage in COVID test kits around town or the long wait time at local pharmacies to get them. You can get a test this week at Agape Family Health. They will be at their location at 5460 Blanding Boulevard today and tomorrow from 11 a.m. to 6 p.m. They will be at their Dunn Avenue location Thursday and Friday from 11 a.m. to 6 p.m. If you want to get a test, agapefamilyhealth.org for more. You can go to the Duval County Health Department Plaza at 515 West 6th Street. Stand in line. There's a long line there right now, according to people tweeting us, but you can get a rapid COVID test there. CVS and Walgreens have tests, but of course you have to schedule them, and there will be a wait. Okay, so Mia Jones, you've been at this for a year and a half, and you've been a leader in fighting this pandemic and getting vaccinations out to the public, getting health information out to the public, providing the test kits, helping people get treated. This as we talk to folks like you and doctors and nurses on the front lines in hospitals, there's just an incredible weariness and frustration at this point, particularly since it's mainly unvaccinated people who are now getting sick. I don't even know how tough it's been for someone in your position. Can you talk a little bit about how you and your staff are dealing with this nearly a year and a half into this time?
It's a day-by-day process. You have to make a lot of changes because ultimately we're there to provide health care above and beyond COVID. And we have a lot of people, and, mainly because that's what everybody is focusing on is the COVID, whereas we have chronically ill patients with other diseases that we need to make sure that they are in a stable place, that they have what they need, that they're taking their medications, that they're coming for their appointments. But at the same time, then we have to make sure that we've got the doors open for this virus that is ravaging our community. I try to keep the staff encouraged. I try to find ways just to put a smile on their face. So it may be, okay, I stopped by Dunkin' Donuts, and here you go, here's some donuts, or here's some Krispy Kreme donuts. And we laugh about the fact that, okay, Ms. Jones, you're bringing in donuts. They're not very healthy. I said, yeah, but, those things are not healthy for you. They put a smile on your face. By the end of the day, they're all gone.
Yeah.
But whatever we can do in order for us to make things easier for the staff, we try to do. For our testing, it is global warming is real. If anybody would have asked me before, I would have said I'm not sure, but the heat that we're dealing with as we're out there trying to test is excruciating. And so I try to keep that staff encouraged as well, because it's almost like that MASH unit that you would see on MASH back in the day. You're in a tent. You're providing service in a tent and trying to make sure people have what they need, but you're doing the best that you can. We don't have a lot of extra space, office space, or open space that we can work inside. We've got some requests out there to see if we can get some, and then we would be able
to help more
go
people.
inside with it.
Thank you so much, Mia Jones, CEO of Agape Family Health, agapefamilyhealth.org. Check it out. Get a COVID test at their Blanding Boulevard or Dunn Avenue location. They will also be outside the downtown chamber this week. You can also, today until 4 p.m., get a free walk-up vaccine at the health department, the Central Health Plaza on West 6th Street in Springfield.
And we also have walk-ups at Gateway.
And walk-ups at Gateway. Thank you, Mia
Wellness
Jones.
on Wheels. Okay.
Thank you so much. And now we join NPR News in Washington for live coverage as the House of Representatives holds its first day of hearings of the Select Committee to investigate the January 6th attack on the U.S. Capitol. Let's listen.
This is live special coverage from NPR News. The House of Representatives Select Committee to investigate the January 6th attack on the U.S. Capitol